Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India. This video contains an operative procedure meant for eye surgeons. Viewer discretion is strongly recommended. And today we are going to discuss about the difficulties faced doing a soft cataract. So this is NS1 to 2 cataract, and my plan was to do a direct chop, but then what were the problems faced and how mechanical chop helped, we'll be discussing here. So the key is to always make a generous 5.25 to 5.5 mm of rhexis in soft cataracts. Helps in the maneuvers. So with a 26 gauge bent needle, the initial flap is created, and with the help of the Utrata, I am aiming to create at least a 5.25 mm of rhexis. Under this external red glow by Zine, no financial interest. The visibility is excellent. A bit of OVD is burped out. And then going underneath the anterior capsular rim, you can see a jet of fluid going past, tapping the opposite pole, and now repeating the same, and we get a free mobile nucleus. This is Cataract's 3 phaco machine. Some of the superficial cortex is removed. The bevel is turned up. Now I was planning to hold the nucleus nicely and chop, but the moment I buried the phaco probe, look what happens. It just eats away the nuclear piece. So now I am using it as a mechanical hold, and the karate chopper goes into the far periphery and I get a good crack. Again, I am not planning to bury the probe because I know it will eat away the soft nucleus. So I'm just placing the probe deep in the nucleus, holding it, and then the chopper does the work. I get 2 quadrants, dialing, and now dealing with the other heminuclei. So again, no minimal energy, see, it eats away. So this 2.8 mm large mouth also helps in giving a good resistance, and we get good 4 quadrants which can be then easily emulsified. So these soft cataracts are very tricky. But the key is, if you are able to do a good mechanical chop, you can divide these nuclei easily. Few points to remember. First, make a generous rhexis. Second, do not try to hold the nucleus because it will eat away and you will not be able to get good cracks. And third is to get a sufficiently long chopper which can go behind and engage the nucleus nicely. In this case, mine was a 1.5 mm karate chopper. Preferably a 2 mm chopper should do even better. I'll be trying in my upcoming videos and will let you know. Now the cortex is being removed with the help of these bimanual IA. These are excellent as they give 360 degrees of access. We can easily clean up the cortex by switching the hands, and that's it. The cortex is managed. And now is the time to implant the IOL. The chamber is maintained, the bag is filled with OVD. The leading haptic goes in the bag. It's a hydrophilic acrylic IOL. And the trailing haptic is then gently dialed in. The OVD is washed both in front and behind the IOL. It's a small palpebral aperture, so we can see a bit of pooling of the fluid. And that's it. The case is done. There's a nice overlap of the rexes, which will ensure a long-term stability. So the take-home message is, these soft cataracts are the hardest to manage. Stop and chop, divide and conquer, or direct chop. Even pre-choppers have been used, but there's not a defined strategy which will work 100% of the times. So you have to evolve and manage the case as in how it comes. I also prefer tilt and tumble, prolapse in the anterior chamber and then emulsify. So these are the various techniques. I hope you like this video. Do like and subscribe to my YouTube channel. Thanks for watching.